Today on Vital Insights.
Now, last spring, CMS kind of kicked in the door for allowing providers to use telehealth, right? And a lot of settings, they were receiving reimbursement for telehealth visits.
Welcome to an episode of Vital Insights, a podcast series focused on thought leaders and healthcare providers who are working to transform the way we care for patients, now and in the future. Though remote patient monitoring, telemedicine, and telehealth have been with us for more than 2 decades, the healthcare industry hasn't been able to embrace it, despite the almost ubiquitous understanding that it's a pretty good idea. One of the primary reasons for the slow movement forward? Reimbursement. Our next guest is an industry journalist who, by his own definition, likes to geek out on the complex evolution around the legislative components involved with reimbursement. Today, we're welcoming Bob Holly to Vital Insights. Bob is the editor for Home Healthcare News with a passion for digging into the details when it comes to interpreting new legislation in the healthcare space. Bob, thanks so much for joining us today.
I'm excited to be here. Normally, I'm on the other end of the virtual microphone, so to speak.
So I love switching it up for you. Are you comfortable over there? Feeling cozy?
I'm comfortable, but I'm definitely more comfortable on the other side usually.
Well, we'll dig into something that you're very comfortable talking about, and I suspect you'll find your comfort factor soon. So here we go. So at a high level, can you walk us through the history and interpret that as you will, behind the reimbursement structure for in-home virtual care technologies, like things like remote patient monitoring and telemedicine, and how that structure, so 2-part question here, either helped or hindered the growth of home health care?
Sure, absolutely. I guess I'll start pre-COVID, and then we could talk about what kind of happened during the spring of last year with some of the CMS emergency waivers, what some of the private health plans have been doing. But telemedicine, virtual care, remote patient monitoring, that kind of thing has never been directly reimbursable for home health agencies.
Right.
And when I say home health agencies, just because there is a spectrum of the types of providers that work in the home, I'm talking about your Medicare certified post-acute care home health agencies. Before COVID, if they wanted to do telehealth visits, they kind of had to pay for that out of their own pocket. It was not something that Medicare would actually pay for. And same with your non-medical home care agencies, though they're a little bit less clinically focused, so they weren't doing too many of those visits to start with. I think even though that's the case, a lot of agencies did leverage telehealth tools and remote patient monitoring because they knew they needed eyes and ears in the home, even when a caregiver wasn't physically present. They also saw it as an attractive tool to win referral partnerships.
Yep.
But overall, it really wasn't ubiquitous. I wouldn't say every provider by any means was using telehealth. Now, last spring, CMS kind of kicked in the door for allowing providers to use telehealth, right? And a lot of settings, they were receiving reimbursement for telehealth visits. Home health care is not one of those settings.
Right.
Since COVID began, and that's still the case now, Medicare still does not pay home health agencies for virtual visits. Again, though, agencies have turned to telehealth more frequently because even more so than before, they know that they need those virtual eyes and ears in the home. But yeah, at least as far as Medicare, providers still can't get paid for telehealth services, and it is a roadblock or a speed bump. Now, Medicare Advantage plans, they need to be able to cover all the things that traditional Medicare covers. But they could also kind of cover some other things on top of that. And that has meant some MA plans do reimburse their provider partners for virtual care. That's kind of been the main pathway for actually receiving reimbursement if I'm a home health agency.
So I'm really glad that you touched on the pandemic, because obviously that has changed so much of what we've seen happen in healthcare, and I anticipate what we will continue to see with healthcare. Can you talk about any additional catalysts that you've seen that have caused additional shifts or complementary shifts to the overall acceptance for remote technologies?
Yeah, definitely. I think one thing, and this has been very well documented, is the typical home health patient is much sicker than pre-pandemic days. Part of that is because hospitals, just because they need to preserve their capacity, they are discharging folks to the home faster than ever.
Yes.
So
Yep.
your home health patient today is, you know, much sicker, more medically complex than ever before. And so home health agencies, they need all types of tools in their toolbox to be able to care for those folks. And going back to our previous conversation with your first question, agencies can't be directly reimbursed for telehealth or virtual visits, but they could certainly be dinged if their patients are frequent flyers to the hospital. So they want to do everything possible to make sure that doesn't happen. And for many, that has meant virtual visits.
Absolutely. So let's shift gears a little bit and talk about kind of what you see as the future of home health. And I'd love for you to just touch on the Choose Home Care Act of 2021. Can you provide an overview of that new piece of legislation?
Yeah, definitely. So this is something that the home health industry is very, very excited about. It's been described as a sniff at home or a skilled nursing at home model, but it's really more complex than that. I think that's a little bit too simplistic to say. Choose Home was introduced in the Senate a couple of weeks ago. It's supported by some pretty well-known organizations like AARP, um, the National Association for Home Care and Hospice, the Partnership for Quality Home Health Care, and several others. I think Leading Age is another aging services group that supports the legislation.
Yep.
And at a very basic level, what it does is it enables home health providers to care for patients coming out of hospitals. That's very important. These have to be folks discharged from a hospital, not from the community, who otherwise would have been eligible to go to a nursing home. And the legislation would create a new payment pathway for home health providers to offer things like telehealth, remote patient monitoring, meals, transportation, supports for activities of daily living to make sure those patients were comfortable and safe in their home. And from a payment perspective, it does that with an add-on payment. So you would still get your typical payment for a home health episode. And then on top of that, kind of a bonus for however many hours of care you delivered as part of Choose Home. The argument for Choose Home from a policy perspective is estimates have found this could save literally hundreds of millions of dollars to the US healthcare system by keeping nursing home eligible patients in the home instead of a brick and mortar long-term care facility. And again, there's been a little bit of pushback from the nursing home industry saying, this would take volume away from us, but there are going to be so many seniors in the U.S. that in my opinion shouldn't be a concern.
So you touched on something that I think is really critical to this conversation, which is, and this is very broadly, but the social determinants of health is obviously a core component of long-term health for people. Do you feel like this gets closer to addressing those social determinants of health than other pieces of legislation?
I don't know. Social determinants of health, that's been a buzzword now for two or
Too
three
long,
years.
too long.
Yeah.
Yeah. I
Yeah.
have a
And
t-shirt which says like hashtag SDOH or something like that.
yeah. So I think this is just another piece of the puzzle. I don't think Choose Home by any means is really making social determinants of health it's core, but definitely part of the legislation.
So going back to Choose Home, how do you feel that it has the potential to really impact the reimbursement structure? So if you get down into the nuts and the bolts of reimbursement, how do you feel this is going to pave the way for greater home health accessibility?
You have a lot of home health providers today who get paid for, the standard services, but they're a little bit handcuffed to go beyond that. They might have to provide extra services out of pocket or as part of a value-based purchasing agreement. But, if I'm running Bob's Home Health Care, and in addition to uh, Medicare certified home health, I also have personal care, and I offer transportation services. I don't have a way in traditional Medicare to leverage those other parts of my business. Choose Home would allow me to do whatever I think is necessary to get the job done and keep people in the home and out of long-term care facilities.
Okay, so where do you think it falls short?
The legislation itself.
Yes.
Well, I mean, I really like what this could mean for the home health industry. It would be game changing. It's really not just kind of a token piece of legislation or a feather in a home health provider's cap. It would change the way home health services are delivered in the United States. And it would benefit a lot of Medicare beneficiaries. If there's any knock on the legislation, it's that some believe the price tag might be really high. The Medicare program, it seems like it's on the verge of going bankrupt every single year. This, to some people, they believe it would just add
Amplify
more
that.
costs. Yeah,
Yeah.
add more costs to the program. But the people who support the legislation, they say, well, hold on a second. Yes, this means more money going to home health, but it's saving hundreds of millions of dollars of payments to the nursing home space, the skilled nursing facilities. So I think we're a little early to really see how that plays out, but that I think is the main hurdle for something like this actually being enacted into law.
That's fantastic. Thank you for that. If we shift gears again just slightly and look at kind of the future of home health, where do you see home health or virtual care fitting into that future of patient care? So when you look out and, conjure up your crystal ball and kind of gaze into it, what does patient care of the future look like to you?
Yeah, and I think for this question, I'll kind of expand that definition of home health. So instead of just talking about Medicare certified home health agencies, you know, I'll say home-based care providers, and we'll also include non-medical home-based care providers, maybe palliative care in the home providers. But in the not too distant future, the home will be the center of the healthcare world. Anything that can be done in the home will be done in the home, from the highest acuity of care, hospital at home models, to your companionship services and your light housekeeping services. As far as virtual care and telehealth and remote patient monitoring, I think that's really the glue that holds a lot of that together, because it's expensive to have a person physically in the home all the time. And if more care is going to be delivered in the home, payers, referral partners, the home-based care providers themselves, they need to be confident that they always know what's going on in the home. So if we're talking about the future of healthcare just broadly, more of it's coming into the home, and for that to happen, there needs to be all kinds of technological advancements in the home.
So, talk a little bit about those.
Like particular services or products?
Sure, either or. Your interpretation of the question would be fine.
Yeah, I mean, our providers are leveraging all kinds of tools, right? Like many are just using things like FaceTime to connect with their patients. Um, you have all kinds of remote patient monitoring vendors collecting vital sign information in the home, to send back to physicians to make sure their patients are doing well. You have tools that can seamlessly be integrated into a home to detect falls. I mean, I've seen some pretty crazy technology that uses almost like echolocation to be able to know if somebody has fallen down.
Yeah. Yep.
You have formerly the company I think was called Great Call, but now they're a part of Best Buy, and they could integrate their technology into a refrigerator to tell if somebody's actually eating. If those tools tell the provider that the fridge hasn't been opened in 2 days, that's obviously a huge problem. That patient isn't getting the nutrition that they need. Scales in the home that are constantly relaying that the information on how much or how heavy a patient weighs to make sure that they're not drastically losing weight. With COVID, obviously, like measuring blood ox levels in the home has been incredibly important.
Absolutely. So you talked a little bit about roadblocks to getting there in terms of reimbursement, but what about scalability?
I mean, obviously, I think scalability would be accelerated if home health providers could be directly reimbursed for in-home telehealth technologies. But yeah, otherwise, I think it's just on the providers to kind of pick up and recognize how these things could make their businesses more efficient, could aid them as they're trying to improve quality of care. And the more providers that recognize those kind of indirect benefits, I think we'll start to see telehealth scaling in the home. Although I guess a caveat to that is we did see this explosion of telehealth utilization early on in COVID and throughout 2020, several 100% more than pre-COVID days. That definitely has leveled out quite a bit. But I think according to Fair Health, some research that they put together, telehealth utilization in 2021 is still 38 times higher than it was pre-COVID.
Yeah. Yeah, it's off the charts for sure. Are there any, and this is just kind of a general wrap-up question, but are there any general trends that you've observed in terms of home health that you're particularly excited about?
See, this is my kind of question too, because as the journalist, it's our job to kind of go a mile wide and an inch deep.
Yep.
So apart from greater adoption of telehealth, another big trend has been hospital at home. This is a model that has existed literally for decades.
Yep.
And it has been vetted. There have been several studies that show just how effective it is, but the model itself never really caught fire until COVID. Part of that was because last November, I believe, CMS rolled out a temporary waiver allowing hospitals to deliver acute care in the home. And as a result of that waiver, there are now dozens of health systems and upwards of 150 or more hospitals that have hospital at home programs. At Home Healthcare News, our core audience is home health providers and non-medical home care providers. They're obviously not delivering acute care, but both of those groups are core parts of hospital at home models. And I'll add that remote patient monitoring and telehealth, those are core parts of hospital at home models as well. Just again, we've said it seemingly like dozens of times so far, but you constantly need eyes and ears in the home to make sure patients are, not suffering an adverse health event when nobody's around.
Right, exactly.
So hospital at home is a big one. Another trend, we've talked about it, but home-based care providers are now able to take on more complex cases than ever before. I see that trend continuing as well. They're just getting better at what they do through some of these technologies we've talked about, but also their clinicians are gaining more expertise. Most providers these days have specialized care programs to take care of patients with COPD, dementia, respiratory problems, all sorts of things. So that's another trend. You're also seeing a lot of providers becoming one-stop shops. Not too long ago, the providers we covered, they were only a home health provider, or they were only a hospice provider,
right?
Or they were only a personal care services provider. But today they see a lot of synergy for being able to kind of control the continuum. So they want to do everything. That's also shaping M&A activity, because you see hospice providers acquiring home health agencies and vice versa.
Well, and when you were talking about kind of the movement into the home of a lot of those services, it becomes the buildings themselves or the organizations themselves even become kind of superfluous because we don't need them anymore. Yeah. We need the expertise and the specialization, but not necessarily the organization itself. So, yeah.
I want to put myself back into the chair that I'm usually in. What about you? I'm just curious to hear, what kind of trends have you seen when it comes to home-based care?
Oh my gosh. Well, you have touched on many of the trends, but one of the things that I continually have seen percolating lately is the concept and notion. So you talked about hospital at home, but the kind of expansion of our definition of vital signs, if you will, and with particular attention being paid to sleep as being a baseline for kind of pure data retrieval. And so sleep as a clinical marker is a trend that I've been seeing percolating like out there. And then with respect to, remote patient monitoring, because I've been in the health technology space for 15 years now. And so I've watched remote patient monitoring kind of grow up and get, a little bit sexier. And then it explodes, of course, during COVID. But it's still very limited by patient compliance, so everything kind of always falls down at the front line if it's going to fall down anywhere, right? So it doesn't matter how great the solution is. It doesn't matter how great the software is to assess the solution and the data points, et cetera, for the provider to look at on the other side. If on the front line, the patient forgets to take their blood pressure or doesn't remember to get on the scale in the morning. And so the idea of removing that piece of the equation, so providing a solution that they don't have to think about, is something else I think we'll see trending soon. So
that is a great point. I was just at a conference in Chicago, and a home health chief clinical officer, I think chief clinical innovation officer to be exact, was talking about how they rolled out a hybrid care model that leveraged both in-person and telehealth and remote patient monitoring. And he started his presentation by saying, I was the biggest skeptic that this was going to work. I thought there was no chance that our patients would, hop on a virtual call with our clinicians, or that they would remember to measure their blood ox or weight or whatever. And he said that he was proven very wrong, that COVID has encouraged a lot of populations that typically aren't tech savvy to really embrace technology. So I couldn't agree more with that point.
Yeah. Any last thoughts that you have for our audience before we wrap up?
Well, back on the reimbursement front, I meant to mention this earlier. There is hope that home health providers one day could receive direct reimbursement for telehealth services. Last year, industry stakeholders introduced something called the HEAT Act that would allow home health providers during a public health emergency to get paid for virtual care. Now, nothing happened in 2020. That legislation was again introduced in 2021. And there's always some chance that it could be tacked on to a broader piece of legislation. And I think a lot of industry advocates that I talk to hope that that's still going to happen. So if you're a home health provider today who has been using telehealth and frustrated that there wasn't more reimbursement opportunities, just stand pat. That could change in the not too distant future.
Excellent. Well, thank you so much for taking the time to join us today. We really appreciate the opportunity to talk to you and gain your insight, and look forward to talking to you again in the future.
Yeah, I had a good time being here. Again, this is kind of new for me being on this side, but I enjoyed it. So if you ever need a guest again in the future, you guys know where to find me.
Excellent. Well, you did really good in the hot seat, I have to tell you. So we will definitely reach out again.
Thank you.
Thank you.